Hi everybody, my name's Christine. Welcome to the Carer Project podcast. This is our first recording today, so please forgive us if it all goes a bit haywire in points. This series of podcasts is exploring what we've found in a really big research project we've done about carer mental health. I'm here today with Gun, Tracy and Danielle, so do you all want to say hi?
Hello, hi, nice to meet you, Christine.
Hi everyone.
Hi. And in this episode we're going to really talk about the results of what we found and the themes that these results fall under. There are 7 themes, and today's we're going to focus on what we found regarding patient condition. But before we do that, Gun, do you want to say a little bit more about what the project was and you know, just a little bit about how we're all here in this room, what we're doing here with
Yes,
this project?
certainly. Well, the background to the project is that we know that family members and friends play a really vital role in supporting patients who are nearing the end of life.
Mm-hmm.
But we know that that also takes quite a toll on their mental health,
Right.
such as, you know, depression, anxiety, distress and so on. So it's really important to look at how we might improve carers' mental health when they're supporting a family member or friend.
Sure.
At this point. So the project looked to gather all the available research evidence on what was known about the factors or things that affect carers' mental health during this sort of caregiving.
Okay.
And then we tried to summarize that in a way that made sense to stakeholders such as carers and health and social care practitioners. And to present it in a format that they could use.
Okay.
To try to make things better.
And that's summarising, that's how these themes have come about that I've mentioned, that is the summary.
Exactly. So we summarised this into 7 themes.
Okay. And I mean, Tracy, who's sat here with me, she was the main sort of researcher on this, doing all the day-to-day work. Can you tell me a little bit, how did you come up with those themes? I mean, where did these 7 themes come from?
Yeah, so we were looking at really sort of what carers felt themselves affected their mental health.
Mm-hmm.
And so we looked sort of around information around what carers had said, sort of their stories. And from that, we identified 6 separate themes
Mm-hmm.
about what was important and what affected carers. So we had themes like we had patient condition, the impact of caring responsibilities, the quality of carers' relationships, their finances, which make have an impact on carers' mental health, carers' own internal processes, so their thoughts about caring and themselves, their feelings about themselves,
Yeah.
and also how they manage and cope, as carers. And also support, so the type of support that is beneficial to carers includes informal support from family and friends, and also formal support, so for example from health professionals. So those themes all came out really from carer stories in the evidence that we looked at.
Mm-hmm.
And then we also looked at a different type of evidence, which was around sort of what we call observational information, and that was very much about sort of more about numbers and looking at information that way, so less about carers' actual experiences, but more about what has been measured and has been shown to affect carers' mental health.
So the real sciencey sort of
Yes.
nerds in lab coats, clipboards, statistics.
Yeah.
Databases.
Yeah.
Okay.
Yeah, that's a good way of putting it. And then we got sort of contextual sort of demographic factors, things around sort of, for example, carers' age, their gender, and also sort of like their health and their physical health and how well they are going into caring.
Mm-hmm.
So those sorts of things.
So today, as we mentioned, this series of podcasts is going to each podcast episode is going to talk about each one of those themes and what we found under each one of those themes, because it was a massive project and there was so much information. This seems like the easiest way to break it down for everybody. And today we're going to talk about the theme of patient condition.
Mm-hmm.
So when we talk about patient condition, what exactly does that mean? Like, what's under that theme? What sort of things are we going to hear about?
Well, I suppose that is essentially about how is the patient doing.
Mm-hmm.
So it's about how are they doing in terms of symptoms, their quality of life, how well are they functioning, and all of those factors would then affect how the carer was feeling, because of course when you're looking after somebody, you're going to be affected by how that person you're looking after is doing as well.
Absolutely. I mean, my partner, he walks around with a cloud over his head half the time, so I don't know if your other half or someone you live with is in a bit of a funk. I mean, a lot of people just even get affected by that. So yeah, if somebody's really seriously ill, you can imagine that's really going to impact on the people that they're living with and surrounded by.
Absolutely.
It does seem really important. So we talked about this being a really big project. Patient condition, was this one of the themes where there was an awful lot of evidence, or something where there wasn't much? I'm going to imagine there was a lot of evidence that you found.
There was it was one of the themes where there was quite a lot of evidence really around patient condition. So quite a lot to look at and analyse and get our heads around.
Okay. And overall, was there an obvious message that came out from this? Was there an obvious thing that you found? What was the impact on care and mental health?
So a good overall quality of life, Gunn has mentioned quality of life, and so the quality of life of the person that the carer is caring for was related to better care and mental health. Okay. Perhaps not surprisingly, although one study looking at patients' psychological quality of life, their psychological well-being really, found no evidence of a link with carers' mental health. So that was a big finding.
Yeah, definitely. So when we're talking about mental health in terms of this project, it's probably worth saying that you've sort of used that as a bit of an umbrella, haven't you? And so what are the outcomes that you looked at? What are the things that you've taken to reflect care and mental health?
So we looked at depression, we looked at anxiety, we looked at distress, and we also looked at quality of life.
Great. Okay. So when we're talking about mental health, it could be any of or all of those things.
Yeah.
Okay.
And we're sort of talking about improvements or deterioration in those 4 outcomes as well.
Yeah, because we talk about worse. It had a worse. There was a link with worse care and mental health or better care and mental health. So thanks, Danielle. So you talked about the patient's quality of life and the patient's psychological quality of life, and it's linked with carers' mental health. What else have you found that's sort of worth mentioning? Because it's probably worth saying these podcasts are quite short, so we're not going to talk about every single thing that you found evidence on. We're just going to pick out some of the highlights. But for anybody who's really interested in something in particular, there's lots of information on the website and in our reports that we're going to publish. So what else can you tell me about what we found that was interesting?
Well, we certainly found a lot of information about how the patient's symptoms affected the carer's mental health. So, if the patient suffered poor mental health, if you like, then it was also worse for the carer's mental health. So if the patient had anxiety, depression or distress or other mental health symptoms, or indeed if patients were uncertain about the future, those are all linked to worse carer mental health, which again makes sense, doesn't it?
Yeah, absolutely. I mean, we're talking about end-of-life carers, so I imagine for a lot of people there probably is quite a bit of uncertainty about what the future's going to look like there, isn't there? It must be, perhaps distressing or just very unnerving for people.
Absolutely.
I think patient depression as well was key. There's quite a bit of information, evidence around patient depression having a link to carers' sort of mental health really, and reduced mental health.
Okay.
Then you also had an impact of patients' physical symptoms, we found. So if patients had more drowsiness or they felt more fatigue or pain, again they were all related to poorer care and mental health. Although with some symptoms we didn't see any relationships, so in terms of loss of appetite or feeling nauseous or having breathlessness, that didn't seem to have a relationship with carers' mental health. But I must say that the frequency of negative symptoms for the patient did affect how the carer was feeling.
Yeah. I imagine that's quite different if somebody's really regularly going through a rough time. I'm the worst patient on earth. I moan about everything, so I imagine somebody caring for me would get fed up pretty quickly. It would take a toll. I mean, yeah, and that was just basic day-to-day illnesses. I can't imagine if I had a serious illness. And I've got a bit of information here. I know we were talking before we started recording about a link between care and mental health and patients' functional impairment. So what was that finding? And what does functional impairment mean?
So my understanding really is that functional impairment is very much about sort of what the patient is able to do and what the carer needs to do to support the patient. So for example, if they're not functioning sort of physically in terms of being able to look after themselves in terms of their self-care, for example, it might be that the carer then needs to put more, to support the patient, in that way. So for example, maybe going shopping for them, possibly dressing their family member or that they're looking after or friend.
And was it that you found that the more of that sort of task they had to do, the worse their mental health was? Was that the link there?
Yeah, definitely.
Okay. And what about, that's functional impairment of the patient. What about sort of cognitive impairment? And again, do you want to say a little bit about what perhaps cognitive impairment is? Because that's obviously different to patient anxiety or patient depression. It's something a little bit different, isn't it?
Yeah, sure. So it's more about sort of the patient's sort of maybe their memory sort of sort of being affected in terms of remembering things or possibly confusion at times. So that's what we mean sort of when we say cognitive, sort of less than rather than the physical impairment. And we didn't find a link with that and carers' mental health.
Okay, that surprises me.
Yeah, it's more the physical impairment that seemed to matter in that case.
Right, that is interesting, because you would think that would be difficult to deal with.
Yeah, you would, yeah.
I suppose what we should note, though, which seemed to be really important, was that if the patient had problems sleeping or needed more help at night, then that did impact on carers. It did lead to worse depression, anxiety and quality of life, which makes sense, because in a sense that is also leads to bigger interruptions and disruption of carers' sleep. It would impact on their ability to rest and so on.
Definitely, and if you're doing a lot of perhaps physical care, because we talked about those physical symptoms and having to look after somebody if they need help with their washing and dressing and shopping, and then you're not getting a proper amount of rest at night, you're probably waking up physically and mentally tired, and then perhaps having a challenging...
The carers then aren't having that time to sort of recharge, their own batteries themselves.
Yeah. Yes, that does make sense. So what else did we find? Are there any other big messages from this theme?
Yep, so there's also sort of worse carer depression, so where patients had sort of worse social well-being, they were sort of used sort of more emotional support seeking, and they showed sort of less acceptance, coping, and perceived that sort of the primary goal of cancer treatment was to sort of cure my cancer, but whereas sort of patients had sort of less used sort of less emotional support seeking, this was actually associated with higher carer anxiety.
Okay. So obviously that study, I think that was just, I'm just looking at my notes, that was just one study that looked at that, wasn't it? That was on cancer patients, which is why that's got mentioned.
Yes, so it's sort of very specific findings from that study, focused solely on cancer patients. Yeah.
And it's interesting that it starts to bring in things like emotional support seeking and talking about some coping and acceptance, which, it's all within the patient, isn't it? So again, it's just we're just saying that's always going to have an effect. It seems on the people that are around them.
Absolutely.
Yeah, and you can also see if the patient is still expecting a cure and doesn't accept that they're actually nearing end of life, then that is quite difficult to deal with if you're caring for them and that they are end of life and are dying.
It must be really hard to know what to do for the best in that situation, whether you go along with it and try to stay positive even though they're not going to be cured, or whether you try to help them understand or make them face up to it. And it must feel like you're in quite a difficult situation, which I can imagine mentally I think that would make me quite anxious. I think. I mean, obviously other people might experience that differently, but
yeah, absolutely.
Okay. So I think we've covered quite a lot of ground there in that theme. So, what are your sort of overall take-homes for the effect of patient condition on carers' mental health, would you say, from that theme?
I think the quality of life of the patient, and the quality of life of patient, and also sort of psychological symptoms are really key, as well as sort of physical functional impairment.
Okay.
All contribute to poor mental health in carers.
Okay.
So I suppose you could say that, if you're trying to support carers, you need to be really aware that if the patient is doing badly and having poor mental health, of course you want to make things better for the patient, but also remember to see how the carer is doing, because that's the situation where the carer is less likely to cope well, and they're likely to have worse mental health themselves.
Yeah. So do you think it's maybe healthcare practitioners who could make most use of this information on the patient condition that we've got, or who would be able to make most use of this piece of information, do you think?
Well, certainly healthcare practitioners, but I think anyone really who is looking to support carers at this point.
Okay. Cool. So that's hopefully been interesting. I think it's been useful to summarise what was found. As we said at the beginning, there was an awful lot of information about the patient condition, probably because in the sorts of research we look at as well, information about patient condition is available through hospital or GP records, and they're often linked into the research. Again, we already mentioned, this was just a summary and just a brief overview of what we found. There was a lot of variables that we didn't discuss, but which are presented in our reports. So if you want more information, please do have a look at our website, or you can just go to the Twitter, which is @CarerProject. Thank you very much for listening today. If you found it interesting, the next episode of this is going to be on the impact of caring responsibilities, and hopefully we'll speak to you again soon if you tune in again. Thanks very much.
Thank you.
Bye.
Thanks everyone.
Bye.